Well, my name is Peter. I'm an assistant professor at the University of California, Irvine, and I've been invited here to talk to you a little bit about my own work and interest in evaluating deep learning as a method for discovering and analyzing novel biomarkers. These are a few of my disclosures which will not be relevant to today's talk. Now, before I start, I do want to point out that it is, in fact, my day-to-day job to think and develop and determine ways in which deep learning can be used to augment healthcare in many different ways. And so this presentation that you're about to see is going to highlight some of that work, but without question, we're always interested in new projects and new ideas and very collaborative in spirit. So if nothing else, if some of this stuff intrigues you, please feel free to reach out to me. I'll have my contact information here at the end of the talk. Now, to get started, the technology that we're going to be talking about today is in fact deep learning. And I won't belabor this point because you guys have heard about it all day and presumably are fairly knowledgeable at this point. But I do want to highlight two things. And the first is, of course, the unique fact that deep learning is a technology that requires no explicit representation of any knowledge that you're trying to learn. It's literally a virtual brain or a network of neurons connected one after another. And intelligent behavior just sort of inherently arises from this sort of simple arrangement. Another way of framing this is that instead of writing very specific code and logic, as you see here that we used to do not that long ago, again, all of our code is now aimed at building these very simple connections between neurons. And so it's a very powerful and flexible new technique. And the other thing I'll quickly point out is, of course, the technology is very new. So prior to about a decade ago, none of these things I'm about to show you would have been remotely possible, right? Something that you couldn't even dream of. And really just in the very past few years, we're suddenly able to unlock this amazing new potential and to really kind of study things that we really had no idea and no way of doing before. So it's a very novel and a new approach. All right, so without further ado, I'm going to dive in here and talk about some interesting AI-enabled biomarkers. Now, before I begin, I should probably define the term biomarker, which can be sort of interpreted quite broadly. Now, in our context today, what I'm going to reference as a biomarker is a metric or some sort of indicator of an underlying biological state. So the physiology of the cells that live inside your body. And now, for the most part, we're talking about non-invasive metrics here. There are, of course, invasive ways to get at what's happening in your body, either through surgery or some sort of tissue sampling. But what we're interested in doing is trying to extrapolate or use as a proxy certain metrics in a non-invasive way from images to, again, get at and try to understand or predict what's going on under the hood. All right, so that's what we're talking about. And I'm going to give you a few examples here that should hopefully highlight and make clear some of these points. Now, the first set of examples I'm going to give you relate to brain tumors. And I should start by sort of explaining a little bit about what's important in terms of trying to understand brain tumors. So typically, after a patient has already been diagnosed with a brain tumor, the most important question that we tend to have is what of the remaining brain, if any, contains residual tumor, or what may one day develop some recurrent or residual tumor. That's typically the most complex question that we have. It turns out that after a patient's been treated, everything kind of looks very ambiguous and very heterogeneous, if you will, and it's unclear at all without usually very intensive testing to determine where a tumor might be. So this is one of the first examples, and it's a very early example from my work. It doesn't even involve deep learning, but I like to point it out because it does highlight a little bit of what we mean here when I say biomarkers. So the question here that we asked ourselves is, can we predict or identify some sort of signal or pattern that harbors, that lets us predict areas that harbor future tumors? So the area in red here is sort of what we see currently on the image. And the green areas that are highlighted here are actually where a future tumor will come and grow back, right? This is sort of the future, if you will. Now, we have no way of telling that this is where the tumor will grow back. It looks quite similar, I'm sure, as you can see here. There's nothing obvious, but it turns out, and it's been long hypothesized, that there's something on these images that we're probably just not able to pick up. And using a very simple histogram analysis, so just looking at the signal intensity at these different locations, over millions and millions of pixels, right? The idea is leveraging big data here. You'll see that indeed the green and the red curves are slightly different, right? Not dramatic, nothing that we could, jump out and see with our own eyes, but it is a definite signal that's here. And with this very slight signal change, we can actually build models to predict the future of tumor recurrence. So this was, again, just the very tip of the iceberg. We're just starting to see now. Maybe there's something more here in these images that, again, our human eyes aren't able to pick up right away. Now, this is an extension of that project, right? And now, instead of using just a single pixel value, which we saw in the prior slide, here we're asking deep learning methods to look at a slightly larger context to make this prediction. We're looking at, in fact, a patch of imaging findings. The algorithm, the deep learning system can, if it decides it wants to, it can use just raw signal intensity like we did before. But if it decides that other more interesting patterns are also important, things like textures or other very complex patterns that you see here, then it in fact can also use those things. And you'll see here that in fact, with the help of our pathologists who will look under a microscope and carefully tell us what's going on at different locations of the brain, we can in fact build and train a deep learning system to go through and make these predictions. So again, picking up patterns now that predict or signal some sort of underlying change in biology on imaging, right? These are the things that we're trying to do. Now, the natural extension from some of this, we started with a single pixel, then moved in to a slightly larger field of view. The natural thing that you might ask yourself is, can we just use a deep learning system or an AI system to look at the entire tumor itself, right? Why limit yourself to small patches on the image? And in fact, that's what we decided to do in this project. In this very specific instance, we're now asking the deep learning system to tell me a little bit about the mutation status of my brain tumor. So what mutations does this particular tumor have, and how might I best treat what's going on? Again, another problem that's typically solved by surgery and pathology, but there's a lot of data here on these 3D volumes, millions upon millions of pixels. So is there something else here that we're missing? And in fact, we trained a deep learning system, and the deep learning system does what deep learning AI systems do, which is it makes accurate predictions, and we were happy with those accurate predictions. But more interestingly, we asked ourselves, can the AI system, after it's finished learning, go back to the humans and tell us what exactly it was that made your predictions so accurate? And using some fancy math, we were able to go backwards, ask the deep learning system that very exact question. What you see here is the very first AI-generated atlas describing the common appearances of various brain tumors, right? So this is the type of stuff that, as a very senior radiologist or physician, after looking at tumors for decades and decades, you may intuitively say, yeah, I think, over the years, whenever a patient comes in with a tumor that has this type of appearance, you're right. I think more often than not, they did have XYZ mutation. But again, this is completely done without any humans and just letting an AI essentially roam free among a large cohort of data to go through and extract out these patterns. So a very interesting and sort of unique approach there. Now, I think you guys are probably getting a hang of this theme here. I'm going to show you a couple more examples now in the world of stroke imaging, cerebral vascular disease. Before I start, I think what I'll do is set the stage again by sort of highlighting the common theme. So in stroke, typically the most important question that we need to ask ourselves is how much brain tissue has died already. All right, brain tissue that has already died is not amenable to therapy. In fact, you might do poorly if you try to treat these patients. So trying to figure out which amount of brain tissue is salvageable versus not is sort of the question we have. And as you might imagine, very similar to some of the prior examples, we have some sort of gold standard truth. So in this case, MRI, that tells us exactly where brain tissue has died. And what we want to ask ourselves is, using less invasive and sort of cheaper, more readily available imaging methods, are we able to go through and predict what will happen to the brain in a few days, right? And the technique we're using here specifically is a CT perfusion type of exam, where we inject a dye and essentially evaluate how much blood flow is in different parts of the brain. These curves here are actually curves that correlate to how much blood is moving through different parts of the brain. And there are standard ways to use this data. There are commonly used metrics that I list here that radiologists have for decades relied on. But we asked ourselves, can we use the AI system to bypass any of these standard techniques and simply predict what will happen here in the future, which tissue ends up dying? And in fact, we do a fairly reasonable job. So here are two examples of patients. You'll see that the areas of predicted infarct, so areas where brain will die no matter what you do, these areas in fact match up very well to the ground truth MRIs that we've gotten in the future, to again figure out which patients might be most amenable for therapy. All right, and so the last example that I want to quickly take you through, they're very similar up until this point, so I do want to add an additional wrinkle to show you a bit of variety. The question in this particular problem remains the same, so it's again, can we ask the AI to help us detect and find which areas of the brain have already died from stroke injury? And to do that, we extract out very specific biomarkers that, again, humans have long known and described. It's essentially the amount of swelling in your brain here, known as the mass effect, and the amount of hypoattenuation, or how much fluid has accumulated in your brain. And we trained the algorithm. The algorithm learned how to do this task just fine. But more importantly, we took the trained algorithm and analyzed and tested over 4,000 patients with stroke in our database. So over 300,000 individual slices of images. And again, we expected a difference because we know these biomarkers correlate. So if you draw out hypothetical bell curves, you'll see that indeed the ischemic patients, the patients with the stroke, have a very different biomarker profile. But what we are very interested in here is that overlap, this triangle, if you will, between the two bell curves. This is where the inherent limitations of our imaging technology are such that we will just simply never be able to be 100% accurate in this test. And so in this particular case, what we're doing is not just using AI to understand or predict biomarkers. We're actually using AI to understand the limitations of what is even possible. And what we can do with a nomogram like this is to allow a physician to ultimately decide how they want to treat the patient, right? If you're reasonably low suspicion for a potential stroke here, you think as a clinician that the patient is doing okay, then you can decide to use a certain threshold all the way up here. Whereas if you were very, very suspicious that the patient has a stroke and you're inclined to sort of treat the patient anyways, then you would in fact use the biomarkers to sort of shift the thresholds in a way to help in your diagnosis. So this really is essentially a way for the AI-enabled biomarkers to be passed on to a human, but sort of retaining a bit of flexibility so that the radiologists can sort of work together and take into account that clinical context before making a final prediction. All right, so with that, I think I'm just about out of time. Again, I want to emphasize the power of deep learning in analyzing and detecting very interesting and sort of novel biomarkers that are otherwise lost on the screen. These are a few of the use cases that we went through. And again, please feel free to reach out to me through email. I'll do my best to get back to you as soon as you can. Again, we're open to collaboration. We love to hear what you say. Thank you very much for your attention and enjoy the rest of the symposium here.